In 5.3, we are going to talk about the muscle system. Now, I'm going to warn you, this is a lot of motions, directional movements, a lot of muscles. Obviously, we're not going to learn all of the muscles, but we're going to learn about the main types of muscles that you should know and be familiar with, along with where they're located and what their function is. So obviously, muscles are involved with directional movements, basically, which means that they have specific motions that they are involved in, and it usually falls within one of the planes that we talked about in the beginning of the year, if you remember, the sagittal, frontal, and transverse plane. We are not, like I said, we're not going to learn about all of the muscles because there's more than 650 muscles in your body. We're going to focus on the most important muscles in your head and neck, your trunk, which is your abdomen area, your upper and lower limbs. So talking about directional motions, we need to understand that the muscles we're going to talk about are mostly going to be moved in an agonist and antagonist motion. That's how they are paired. And the first thing that we need to know is, what is a tendon? Remember that a tendon is a muscle that attaches to a bone. There are two parts to this attachment. There's an origin and an insertion. So the origin is when you have the end of a muscle that's going to be attached to a fixed structure. So that's the structure that's not going to move. So if you look in this diagram right here, you can see that the bicep has an origin, which means that it's attached to a fixed structure, which is going to be the scapula. The insertion is going to be a muscle that is attached to a bone, and that bone is actually going to move when the muscle is contracting. So the insertion here for the bicep would be with the radius that you can see in this diagram. So if you try to move your biceps, you can see that your scapula isn't really going to move because that's your origin, but as you move your radius and you contract it, and as your biceps contract, your radius will move, vice versa. So the first plane that we are going to talk about is your sagittal plane. Remember, your sagittal plane allows you to have the movement of forward and backward motion. There are 5 motions that are encompassed in your sagittal plane. The first one is called flexion, which is basically bending. You can bend your head forward and backwards. You can bend your upper body. You can bend your upper arm, your forearm, your hand and hip. All of these can be involved in flexion. And you can see in the diagram that an example they use is your upper arm moving up away from your body. So then when you move back towards your body into the anatomical position, returning back to a normal position, you are showing extension. When you have hyperextension, this is when you are kind of going past your anatomical position. Usually you don't want to exhibit this kind of motion a lot because it's not natural for your body, but it can be done to a certain degree. And you can see all of those in the diagrams here. The first one is showing flexion. Second one is showing extension, returning back to the anatomical position. And third one is showing hyperextension, which you are going past a certain point. Also involved in sagittal plane movements, you have dorsiflexion and plantar flexion. Dorsiflexion is when you are lifting your foot towards your knee or towards the top of your body, and plantar is when you are moving it away from your towards the ground. So the way I like to remember is plantar, you're planting your feet, so you're going more towards the ground. Dorsy, you are going the opposite direction. You're moving it towards your upper body. The next plane that we talked about is frontal plane. So in frontal plane, there is a good amount of movements. The first one is called abduction. If you abduct something, you're taking it away. So when you have an abduction motion, you are going to move away from the midline of your body. So this is like you're moving, in this picture it shows you're moving your foot or your leg away from the midline of your body. Adduction is when you are moving towards the midline of your body. And so you're adding it back towards the central plane of your body. Then you have inversion and eversion. Inversion is when you're going towards the midline, so you can see that the ankle is moving, causing your foot to move towards the midline of your body. Eversion is when you're going the opposite way. Both of these in dramatic effects can be very painful and can cause a lot of damage to your ankle bones and your ankle joints. So please be careful when you are exhibiting this kind of motion, especially during sports, and it's an aggressive motion in either way. You also have radial and ulnar deviation. They kind of are in the name. So for example, radial deviation is when you're going towards your thumb, because remember, radius is on the side of your thumb in both of your arms. When you have ulnar deviation, this is when you are going towards your pinky, because remember, your ulna is located on that side. You also have lateral extension and flexion. Lateral flexion is when you have your trunk and your neck moving away from the anatomical position. And then lateral extension is when you're returning back to the anatomical position. So you can see a pattern here that usually flexion is going away from the anatomical position, and extension is bringing it back. The next plane is your transverse plane. In your transverse plane, we have a couple of motions. First of all, you need to know that usually in your transverse plane, you're going either right or left. So you're either moving your head right and left, or you're moving your trunk right and left, side to side, however you want to call it. So you have medial and lateral. So medial rotation is when you are medially rotating your arm or leg. So this is going towards the center of your body. Lateral is going away from the center of your body, so it's going outward. Medial, you're going inward. Lateral, you're going outward. Also in your transverse plane, you have these two words that you probably might have not heard of, pronation and supination. Pronation is when you have medial rotation of your forearm, which causes your palm to face down, okay? Supination is when you have lateral rotation of the arm. So this causes your arm to face up. You're facing palm up. What I like to remember is a lot of people say this as supination or supination. If you think about it as supination, if you're holding a bowl of soup, you have to have your palm facing up. And so that is one way to just remember supination or supination versus pronation. Then there are some movements that are going to take place in multiple planes. So for example, pronation at the subtalar ankle joint, which basically means the subtalar ankle joint is where your feet and your ankle bones meet. You're going to have three types of motions. You're going to have eversion, which means your foot is going to move away from the midline. You're going to have abduction, which means that you're moving away from your body. And then you have dorsiflexion, which is your foot is moving towards your knee. It's moving upward. Then you also have supination at the subtalar ankle joint. You can have inversion, which means the sole of your foot is towards the midline of your body. Adduction, which is when you are returning back to your body. So remember, abduction, you're going away. Adduction, you're returning or adding it back to the anatomical position. And then you have plantar flexion, which is coming back. It's when your foot is planting or is going down. So remember, plantar, you're planting your foot firmly down. So it's going in a downward motion. You also have something called circumduction and opposition. Circumduction is when you have the movement of a ball and socket joint. So it's kind of like a circular motion. You can think of it, it's in the name, circumduction, circular motion. So you can do this with your wrists. You can kind of do this with your ankles. Opposition is when you have, it's pretty much when any four of your fingers are touching your thumb, because remember we said that we have the ability as humans to have an opposable thumb, which allows us to grasp objects. So chimpanzees have this too. A lot of animals, other animals don't, but we can take our thumb and have it go across our entire palm, which helps us to hold items better. Okay, so now we are going to get into muscles. The first group of muscles we are going to talk about is your head and neck muscles. There are 3 groups of these. So that means they can be put into 3 different categories. The 3 categories are going to be your facial muscles, your chewing muscles, and your neck muscles. Your facial muscles, when they contract, they actually pull on the skin of your face, and that's how you get many facial expressions. They also are the ones that allow you to kind of have different characteristics on your face, because, you know, even if you smile, a person, you can tell a group of people to smile and they're all going to look different, because we all, though have the same muscles, the way that the pull on the skin is going to look different. Okay, so most of your head and neck muscles are going to come in pairs. The only ones that don't have pairs are these 2. Your orbicularis oris, which is around your mouth. So if you want to write that down, your orbicularis oris is the muscle that goes around your mouth. This does not have a pair. And then your platysma, which is the front and sides of your neck. So the platysma muscles make up the front and sides of your neck. These do not come in pairs. Again, orbicularis oris is the one muscle around your mouth. Platysma is the one that is going to be located in the front and sides of your neck. So let's talk about the main types of facial muscles that I want you guys to know. Frontalis, all right? This muscle, where is it located? It's going to be on your forehead, as you can see here. It's going to connect your cranium to the pretty much the skin right above your eyebrows. And what does it involve in? So this helps you to move your eyebrows up and down, mainly up, because you don't really, when you move your eyebrows down, it's just going back into your normal position. And it causes you to wrinkle your forehead. These are the main 2 functions that your frontalis is works with, but you can see how it makes up a large unit of your forehead. The next one we talked about is your orbicularis oculi. This is the one that is going to be around your eyes. Do not get this confused with orbicularis oris. Oris is mouth, oculi, like occipital, has to do with eyes, right? So this is the one that's going to go around your eyes. This helps you to close your eyes, helps with squinting. And if you zoom in here, you can see how it makes a perfect, nice circle right around your eyes. If I'm going too fast, you guys can pause this video so that you can catch up with the notes. Nasalis, obviously, like it says in the name, is the muscles that make up your nose. What is the function? It allows you to kind of change the size of your nostrils. You can flare them out, not flare them out, kind of squint your nose. So move your nose around. All of those are involved, are able to be done because of your nasalis muscle. Your orbicularis oris. This is the one that is going to, like I said, is unpaired. This is what's going to be around your mouth. And this helps you to close your lips, kind of pucker. It's called the kissing muscle. So you can see right here, orbicularis oris. So there is another different muscle that helps you smile. This one is just the one that's around your mouth that helps you. They call it the kissing muscle because that's the best thing you can really describe it as. Your zygomaticus, remember we talked about your zygomatic bone. So your zygomaticus is going to be located right where your zygomatic bone is, which is on your cheeks. Cheekbones, it comes down to the corner of your mouth, and this is called the smiling muscle. So you can see your zygomaticus. There's like, it's broken kind of into two. It comes into the corners of your mouth, allows it to pull on those muscles when you smile. And then you have your platysma. Remember, this is the other unpaired muscle. This is going to be on the front and back of your neck and on the side. I'm sorry, it's on the front and sides of your neck. These are also unpaired. These can actually pull the corners of your mouth down. So if you kind of do that motion, you can feel that muscle kind of tense up in your neck. And it also helps you to open up your mouth very wide. So if you try doing that now, you can feel your neck and you can feel the platysma moving as well. Then we have something called the chewing muscles. There's two muscles in this that you need to know. One is called the masseter, which is going to connect your zygomatic bone to the mandible. Remember, mandible is the lower part of your jaw. Zygomatic bone is your cheek bone. And so this allows you to close the jaw. You also have something called the temporalis. So that's why if you ever start chewing or you're watching someone chew, you can actually see this temporal part of their head move, even when they're talking. And that's because this helps with closing the jaw. So this is going to help the masseter, which is a muscle that we just saw, assist with closing the jaw. And you can see that right here. It's a pretty big part of your muscle in your head. There's one main muscle that we need to know for your neck, other than the platysma. This one is called sternocleidomastoid. These are going to make up the sides of your neck. You can kind of see that they're underneath the platysma. They're kind of tucked in there. And this helps with the flexion of head, whether you are bending it down. Mainly, that is the one that is going to help move your head in that direction, or you're moving it side to side. So this is going to be involved with, like it says here, the rotation of the head toward the opposite side of contraction. So that's a super important muscle. So when you move your head around, you can kind of put your hands on either side of your neck, right under your ears. And as you move your head, you can feel the tightening or the flexion of that muscle. All right, so let's get into trunk muscles. Before we do so, though, there's a couple things you need to know. The first thing is the importance of trunk muscles is that they help to stabilize the vertebral column. So they help to maintain an upright posture. Football players have to make sure that they strength train their neck and trunk muscles so that they can have maximum spinal stability and the minimum amount of damage to their spinal cord and to their internal organs. Because that's where, most of their activity is based off of there, and that's where they take the most amount of hit. Trunk muscles are also enable you to do flexion, extension, hyperextension, lateral flexion, trunk rotation, and they also protect the organs in your thoracic and abdominal cavities. So they help with urination, childbirth, so on and so forth. And they're a protective covering for your organs, like it says, in those two areas of your thoracic and abdominal cavities. So your anterior trunk muscles are heavily involved with going to the bathroom, breathing, childbirth, things like that. Those are going to use all of your trunk muscles pretty much. So what are the major trunk muscles? The first one is called your pectoralis major. You probably heard about this, worked it out. Some of the equipments in the gyms have specific machines that work out your pecs. So where are they located? Obviously, you can see in this picture, they're located in your upper chest. They help to, connect your sternum, your shoulder girdle, your upper ribs, all to your humerus. So when you're moving your upper arm, you're actually moving your pecs as well. So what are some of the functions that they're involved in? They're involved in adduction of your arm, bringing it back to its anatomical position. They're involved in flexion of your arm. So anytime you move your arm away from the anatomical position, you are also using this muscle. Your rectus abdominis, also known as your abs. This is going to be located in the center of your abdomen. These are going to connect your ribs to your pubic bone, which is known as your os coxae. So you might remember that from the previous chapter. These are involved in flexion. So this is when you are moving your trunk, bending down, and also in lateral flexion. So going away from your midline of your bone. So moving side to side in a side to side manner. You also have your external obliques. Working at your obliques is a great way for you to stabilize your core, get rid of those love handles. So this is going to be located on the front part of your abdomen. So you can kind of see it right here, your external oblique. Don't get that confused with your internal oblique that we'll talk about next, but your external oblique is going to be in the front of your abdomen. This is what is going to connect your lower 8 ribs to your iliac crest, which is the upper part of your hips that you can feel. These are also going to be involved with flexion and lateral flexion. Remember, lateral flexion is when you bend sidewards. And then these are also going to help with trunk rotation as well. Your internal oblique, these are the ones that are going to be under your external oblique. They're going to connect your lower 4 ribs to your iliac crest, and they are going to be involved in flexion, lateral flexion, and also trunk rotation as well. So remember, external oblique connects your lower 8 ribs to your iliac crest. Internal oblique is going to connect the lower 4 ribs to your iliac crest. Your transversus abdominis, this is going to be under your internal oblique. So remember, you have your rectus abdominis, then you have under that, not really under, but kind of next to it, your external oblique. Under your external oblique, you have your internal oblique. Under your internal oblique, you're going to have your transversus abdominis. This is going to be on top of something called your peritoneum. This is a membrane that forms the lining of your abdominal cavity. It also lines organs in your abdominal cavity. And the function is going to be flexion, lateral flexion, rotation. And the peritoneum is going to really make up the innermost part of your abdomen. This picture does not show your transversus abdominis, but it does show your rectus abdominis, your internal oblique, your external oblique. So you can kind of get an idea of where those muscles are and what they look like. All right, so now let's talk about your posterior trunk muscles. We just talked about your anterior trunk muscles. Remember, the ones in the front. Posterior are the ones in the back. So the back muscles, the main 2 ones you need to know are your trapezius and your erector spinae. Your trapezius is basically your upper backs, right? These are the ones that are going to actually connect to all the way up to your skull, and throughout your thoracic vertebrae. They're going to connect to your clavicle and your scapula. And they're going to be involved with the extension of your head, bringing it back to its normal anatomical position. It's going to help with hyperextension of your head, moving it backwards or, out of the anatomical position kind of field or field of motion. So you can see that right here, your trapezius, where you can see it kind of going up. It's a little blurry, but up, it's moving into your skull. It's covering your scapula, your clavicle. It's moving downward as well, kind of covering your thoracic area. Then you have something called your erector spinae, which is called the straight spine. So this is actually called a straight spine because it literally covers and moves along the entire the vertebral column. And this is going to connect the vertebrae that are next to each other with each other. This is going to help with extension, lateral flexion, and rotation of your back. So you can see that the erector spinae muscle group, it's kind of underneath the top layer of your muscles, and it's going to go all the way down your vertebral column. Okay, so trunk muscles that are involved in breathing. Diaphragm is important. This is what is separating your abdominal and your thoracic cavities. Remember, your abdominal cavity is lower than your thoracic cavity. And the function of your diaphragm is pretty much to enlarge your thoracic cavities as your lungs expand, and helps with the regulation of breathing. You also have your internal intercostal muscles. These are the ones that are going to connect the ribs together pretty much. So they're going to be between the ribs, kind of making sure that the adjacent ribs are connected to each other. They also expand when, they decrease the thoracic cavity when you have a forced expiration. So basically when you are breathing a lot or taking a deep breath, they kind of help to move those ribs so that they're kind of moving along with you. Then you have your external intercostal muscles, which are also going to connect the ribs. And these are going to help the diaphragm when you are breathing and taking in a deep breath, as the diaphragm expands and comes back and also expels the air that you are breathing. So the internal intercostal you can see right here, and the external intercostal you can see here. So they are the ones that are kind of bridging together the ribs so that they are able to move together along with your diaphragm and your thoracic cavity. You also have your transversus thoracics. These are the ones that are going to be really located really deep within your intercostal muscles, your internal and external, and pretty much they just function in helping you breathe. You don't realize how much breathing actually expands your ribs and your thoracic cavity. So they need to have flexible muscles that move with those two things in order for you to not be in pain and feel like, you're having a hard time breathing. All right, let's talk about upper limb muscles. Some things you need to know is that these are the muscles that are going to cover your shoulder, your elbow, your wrist, your fingers. You have 9 muscles actually that are involved with your wrist. You have 10 muscles in your hand. And the muscles, the way that they're named is because of how they cross the joints or the bones that they actually connect with and help with their motion. So let's start off with the shoulder muscles. The first shoulder muscle you need to know is your pectoralis major, which helps with the adduction of your arm and flexion of your arm. This is located in your upper chest, and it connects the sternum, shoulder, girdle, and upper ribs to your humerus. We talked about this in your other slides, so just repeating that again. Your deltoid is your external shoulder, the muscle that kind of covers your external shoulder part. You can see it right here. And this is going to connect your scapula and your clavicle to the humerus. And it's going to help with the extension. So when the part of the deltoid that covers your external shoulder is going to help with abduction and flexion of your arms and your shoulder muscles. The ones that's connected to the scapula and clavicle that's connecting it, both of those to your humerus, are going to help with extension and rotation. So you can kind of see the deltoid muscle here as well, covering your shoulder. And underneath the deltoid, you have your clavicle. You can see your scapula, all of those connecting to your humerus. Your latissimus dorsi is your muscle that connects to your mid and lower back, which is going to be involved in extension and abduction of your arm and your lower back. It's also going to connect your lower vertebral column with your lower ribs, which will also connect to your humerus. And this will help with medial rotation of your arm. So you can see your latissimus dorsi right here, where the arrow is pointing to. You can also see in the picture on the left, and you can see that the latissimus dorsi does indeed bind to the humerus. And and that allows with your arm movement of as well. All right, let's go into your elbow muscles. The first one is your biceps brachii, which is known as your biceps. Where are they located? Your biceps are located in the anterior part of your arm, so the front part of your arm when you are in your anatomical position. This helps with the flexion of your forearm. They also connect to the scapula and the radius. So the biceps help to bind your scapula all the way down to your radius. So think about that distance. Touch where your scapula is on your shoulder, touch where your radius, which is on the side of your thumb. Your biceps run all the way from the top of your scapula to the radius, top of your radius, be near your elbow, and this helps with supination or supination. Remember, that's when your palm is facing up like you're holding a bowl of soup. You also have brachialis, which is it's also on the anterior part of your arm, but this is going to connect your humerus to your ulna. So biceps connect your scapula to your radius. Brachialis is going to connect your humerus to the ulna of your arm. This helps with the flexion of forearms. You can see the brachialis right here, where it's kind of sitting adjacent to your biceps. Another one is brachioradialis. This is, can you guess what it's connecting to? It's connecting your humerus to your radius. This also helps with the flexion of your arm. So biceps brachii, which is just biceps, people refer to as brachialis, and brachioradialis, all of them are involved with the flexion of your forearm. And you just make sure you remember which one connects which bone to which bone. So remember, biceps are connecting your scapula to your radius. Brachialis is connecting your humerus to the ulna. Brachioradialis or brachioradialis is connecting your humerus to your radius. You can kind of, brachioradialis is easy to remember because it has brachio, which is mainly located in your humerus, attaching to the radius of your arm. Then the last muscle to know for your elbow is your triceps brachii. Triceps are located in the posterior or back part of your arm. This is going to connect your scapula to the humerus and ulna of your forearm. And this is going to help with extension of your forearm. So flexion is when you are really going away from your anatomical position. So you're flexing your arm. Extension is returning it back. You can see the darker red that's highlighted here, and that is your triceps. Okay, so lower limb muscles, couple things to know. These are the ones that are really going to be involved in your hip, knee, ankle, and joints of your foot. You have a ton of these in your leg, and these are important because this is literally helping you from movement, any type of movement, to just standing as well. If you look on page 180, this does a really good job. The first thing is your hip muscles. So your hip muscles, the first one is called your gluteus maximus. You probably heard of this one. This is literally the external part that makes up your butt. And it connects your pelvis to your femur. So you can see that right here, your gluteus maximus on the right. It's connecting your pelvic bone to your femur. And this is going to help with extension and lateral leg rotation as well. Going along with gluteus maximus, you also have something called gluteus medius and minimus. You can see medius is right here, right above. It's located underneath the gluteus maximus. So the gluteus medius and minimus are mainly going to connect your ilium to your femur. And this is going to help with medial rotation of the leg. So it's going towards the medial part of, or middle part of your body. So those are the two main things you want to know for your hip muscles. Gluteus maximus connects your pelvis to your femur, and gluteus medius and minimus is going to connect your ilium of your pelvic bone to your femur. Then we have your knee muscles. The main one of the main ones, there's three of them, is your quads or your quadriceps. These are located on the front part of your legs. They're going to connect the ilium of your pelvic bone to the femur and then to the tibia of your legs. They're going to be involved in extension of the leg at the knee. They are grouped together. So the group members that they're involved in is your rectus femoris, your vastus lateralis, your vastus medialis, and your vastus intermedius. So quads are, quad, right? Four, group of four. So they're involved in a group of four muscles, and these are the ones that are the other three muscles that they are involved with: the vastus lateralis, vastus medialis, and vastus intermedius. They're really easy to remember because lateral, medial, intermediate. And then the rectus femoris is the one that has to do with the hip. Then you have your hamstrings. So remember, quadriceps are the front part of your leg. Hamstrings are the back of your leg. This is going to connect your ischium to the bones of your leg. The hamstrings in the back of your leg, they are involved with the flexion of your knee. Some parts of the hamstring actually does cross the hip, which helps you to extend your knee a little bit more. So if you're sitting, you can extend your knee out and you can feel it. Your hamstrings kind of has a pull to it. A lot of people who have tight hamstrings can't extend their leg or touch your toes when you're standing. I'm one of them, and I need to definitely work on that. They have group members as well. Their members are your biceps femoris. Remember, biceps femoris is not the biceps that are in your arm. These are the biceps that are related to your femur. You have your semitendinosus and then your semimembranosus. So you can see that in the diagram here. You can see the biceps femoris is kind of in the middle. You have your semimembranosus kind of on the more medial side, and then your semitendinosus on the lateral side. Those are the three members that make up your hamstring muscles. Then you have your sartorius. This is called the Taylor's muscle. This is what is going to cross the anterior part of your thigh, and it's going obliquely, and it's going to connect your ilium to your tibia. This has to help with flexion, abduction, and lateral rotation of your thigh. They don't have any group members. You can see the sartorius right here. It's running obliquely, so it's kind of like running slanted. And so it's going to connect all the way from your pelvic bone, the ilium and your pelvis, all the way down to the tibia that you can see where it ends in this diagram. So, talking about ankles and your foot muscles, there are three of them that you need to know. Gastrocnemius, this is your calf muscles on the back of your leg. This is going to connect your femur to your calcaneus bone. Remember, calcaneus bone is in your ankle through the Achilles tendon, all right? So it's going to connect your femur to the calcaneus bone through the Achilles tendon. This helps with your plantar flexion of bone when you push your foot down towards the ground. Also helps with the flexion of your leg at your knee. You can see your gastrocs in this person is pretty thick and very well built. Then you have your soleus, which connects your tibia and fibula to your calcaneus. This helps with plantar flexion. This is also located in the back of your leg, so you can kind of see it's underneath your gastroc. And then you have your tibialis anterior, which is going to be located in the front part of your leg or your shin area. And it's going to connect your tibia to your tarsals, which is part of your ankle bones, and also to your metatarsals. So you can see right here, the bottom is the label pointing to the tibialis anterior. It goes all the way down to your talus and also your metatarsals, which are your ankle bones. All right, let's do some true and false review. Circumduction is a multiple plane movement, true or false? If you said true, you are correct. Supination is a multiple plane movement, true or false? If you said true, you are correct. The insertion is the fixed end of a muscle. Is that true or false? Is it fixed? No, it's not. It's what causes the muscle, when the muscle contracts, it causes the skeleton to move, the bone that it's attached to move. So this is false. Extension is a sagittal plane movement. That is true. Adduction is a frontal plane movement. That is also true. So number 1 is true, number 2 is true, number 3 is false, number 4 is true, and number 5 is true. All right, so let's match the area of your muscle group with the muscles. So your temporalis, where is that located? Head, trunk, upper limb, or lower limb? Think about the bone. The temporal bone is located in your head, so therefore your temporalis is also located in your head. Brachioradialis, is this in your head, trunk, upper limb, or lower limb? If you said upper limb, you are correct. External oblique, where is this located? It's located in your trunk. Biceps femoris, where is that located? Femoris, it's going to be in your lower limb. Anytime you hear femoris, think of your femur. It's going to be located in your lower limb. Now, these are the layers of tissue in your abdomen that I would like you guys to know and write down in that little chart you have in your notes. The first one is your epidermis. Remember, we talked about this when we talked about skin, your top layer, what you see. You have your dermis. You have your hypodermis. This is where you have your fat tissue. You have your deep fascia. You have your rectus abdominis. Remember, this is your trunk muscle. You have your external oblique. Underneath that, you have your internal oblique. Underneath that, you have your transversus abdominis. You have your peritoneum. And then, which kind of like wraps around your organs. And then you have your organs, your abdominal organs.